doctor ordered morphine for males. I'm going to.
I'm just gonna read the notes here. I've got Miriam Adib here, post-rib fracture. That's what she's admitted for, and the doctor has ordered morphine. Okay, so I'm just gonna get someone to assist me with identifying my patient. Could you please be my RN to do my first patient check?
Yep.
Okay. Good morning, Miriam. My name is Moses, student from UWS. I'll be looking after you today. So I'm just gonna be asking you some series of questions. So please bear with me. Could you please state your name and date of birth for me, please?
My name is Miriam Adib. Date of birth 7th of 1st, 1969.
Okay. So that's Miriam Adib Miriam. MRN number, that's 174963.
Yep.
174963.
Yep.
Date of birth is 07/01/1969.
Yep.
Okay. Before I go in further, do you have any allergies?
No.
No. Okay. Thank you for that. Also, can you please just tell me about your pain? How is it if rating it 1 to 10, 10 being the worst?
It's 8 out of 10.
8 out of 10. Okay. It's all good because the doctor has ordered morphine for you, so we'll get that under control. Oh, as well, your pain, how is it? Where is it? Where's the location? Is it radiating or?
It's radiating to my back, on my right side of my chest.
I just need to ask you, when did they insert the cannula for you? This one, yeah.
They put it in this morning.
This morning. Okay, it looks perfect for me. No signs of phlebitis, and it looks perfectly good for me. So bear with me. So I'm just gonna go and gather all the equipment for you. Then we'll be back and I'll explain whatever we need to do next. So here's the call buzzer. So if you have any issues, just call me. Then I'll be back. All right. Thank you very much. We'll be back. Okay. Could you please be my RN to do my validation?
Yeah.
Okay. Thank you. So we've got Adib Miriam, MRN number 174963. Date of birth 07/01/1969, and the doctor is Hunt. She's here because of post-rib fracture. She has nail allergies. The doctor ordered morphine for her, which is 50 mg in 50 ml. The doctor signed and dated it, left his printed his name and left his pager name. The concentration is 1 mg in ml. Number of syringes is 3. PSA dose 1 mg. Lockout interval 5. Basal infusion 0. Hourly dose limit is 12 mg. And also the doctor ordered ametics, metoclopramide. Dose and route is 10 mg IV. TDS is signed and printed, signed and dated it. Also naloxone, just in case our patient has drug overdose, and that metoclopramide is for nausea. So naloxone, the dose and route is 0.2 mg IV. Interval 2 to 3 minutes. Signed and dated it, the doctor. Okay, thank you. So I'm just gonna gather all the equipment, but before I do that, this will be the time that I'll do my baseline obs. And before I do that as well, I'm just gonna talk about morphine. I'm just gonna talk about morphine a bit. Morphine is in narcotic. It's in used form. Moderate severe pain. Contraindication are opioid hypersensitivity, severe bronchial asthma, obstructive airway disease. Adverse effects, this could be respiration depression, circulatory depression, cardiac arrest, and impaired alertness. PSA dose, it will be 0.5 to 1.5 mg for adults. Okay, and it is also compatible with It's also compatible with normal saline.
The second drug I want to accept is normal.
So I'm going to gather. I'm going to gather all the equipment now. We've got more. We're here to get morphine for Miriam Adiba. So remember, we've already confirmed the name and date of birth, MRI number 174963, date of birth 070169, under Dr. Hunt for post-rib fracture. So we've got morphine 50 mg in 50 ml, doctor signed and printed. Doctor signed and dated it. Printed his name and left his pager. So we've got morphine PCA. Concentration is 1 mg in ml. Number of syringes 3. PCA dose 1 mg. Lockout interval 5. Basal infusion 0. Hourly dose limit is 12. And he left his initials there. So I'm just gonna get it. Okay, so morphine.
Hey, I found some PC machines. I always stuck these PC machines.
Okay, so we've got morphine sulfate, right? So we've got that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. So we've got morphine sulfate, 10 mg in 2 ml, expiry date 1020. Morphine sulfate, expiry date 1020. Morphine sulfate, 1020. Sorry, expiry date 1020. 10 mg in 2 ml.
Yep.
Same. Morphine sulfate, expiry date, if you're happy with that one.
Yep.
So it's 23. So today's date is 23/05/17. Time is 10:40. And we've got our patient's name is Adir Miriam. Amount to be given is 50 mg, and we're going to take out 5. So we're going to take out 5. So we've got morphine sulfate 10 mg in 2 ml, expiry date 1020. Morphine sulfate 10 mg in 2 ml, expiry date 1020. Morphine sulfate 10 mg in 2 ml, expiry date 1020. Morphine sulfate 10 mg in 2 ml, expiry date 1020. Morphine sulfate 10 mg in 2 ml, expiry date 1020. So that's 1, 2, 3, 4, 5.
Yep.
So we're taking out 5. So we're gonna have 18 remaining. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
Yep.
So it's all morphine sulfate. Morphine sulfate 1020, expired at 1020. Morphine sulfate 10 mg in 2 ml, expired at 1020. Morphine sulfate 10 mg in 2 ml, expired at 1020. Morphine sulfate 10 mg in 2 ml, expired at 1020. Morphine sulfate 10 mg in 2 ml, expired at 1020. So that's all morphine sulfate. So this is 18. The balance is 18. The name of the prescriber is L. Hunt. The person administering is Moses. Lovo. My signature. Could you please sign? Yeah. Date it. Okay, so I'm just gonna put this back in there. So we've got 1, 2, 3, 4, 5. Let's go. Just clean my hands. Alright, so I've already got my morphine from the drug cupboard. So it's I've got 5 vials, which will make up 10 mg of morphine. Sorry, 10 ml of morphine. So I've got 5 vials, so that will be 10 of it. Okay, so I also have got normal saline. So my normal saline expiry, I've got 4 of them. So to make a total of 50, that's what the doctor has ordered. So I've got normal saline, expiry date December 18, sodium chloride, expiry date, which is just same as normal saline. Expiry date 18 December, December 18, December 18, December 18, and 5 of them.
Yeah.
So I'm just going to draw up my, that's my first drug check, so I'm going to draw up my medication.
Okay.
So I'll start with normal saline.
You say cannella. Just say cannella this morning, eh? Don't say yesterday or whatever. Just say this one. That's
Okay, let's do it quickly, sister.
Should I keep this here or wait?
Okay, you want me to start? You want me to start?
Okay, start. Okay, I'll do my first hand rub. And I'll do the patient note here. Patient is Adi Miriam, date of birth 7/1/69. History of fracture graves. History of giving morphine 50 mg. 15 minutes. Morning, Miriam. Morning. My name is Tina and I'm a student nurse. And today I'll be looking after you. So I just went through your medication chart and I can see the doctor has prescribed to give you some morphine for your pain using a PCA machine. Is that okay with you? Okay. So Miriam, before I can give you a medication, can I please ask you to tell me your full name?
Okay, so can you please come and check? So I've drawn.
Just may have
So
a
I'll
look at
just
your
fix
wristband.
it
So
again.
Miriam Adib, and date of birth is 7 January 1969.
So I've drawn my
And do you
my,
have any known allergies?
my normal saline,
Yeah.
which is now 40. So now I'm going to add my morphine
That's 174.
to make a total of 50.
Okay, that's
Okay.
good. Also, Miriam, I have a few questions regarding your pain.
Okay.
So, can you tell me, like, where exactly is your pain?
This is my chest.
Chest, and do you know what caused this pain?
Movement.
Yeah. And how long have you had this pain for now? Ever since your surgery? Okay, that's. Yeah, and also how would you rate your pain between 1 to 10, 10 being the most?
8.
Eight? Okay. Okay, that's good. And hopefully this medication is gonna help you with your pain. Okay. So also before I can give you a medication, I also have to have a look at your IV cannula. Can you please tell me when this IV cannula was inserted?
This morning.
This morning? Okay. Yeah, I don't see any swelling or redness around the area. So do you feel any pain when I touch this? Okay, Miriam, I'm happy to give you the medication using your IV cannula and
Could you please be my
using the PC
second
machine.
RN to do my second drug check?
Before I give you a medication, I will give you
So-
a full set of vital signs check on you.
So I've got Miriam Adibia. We've already confirmed the doctor ordered 50 mg, 50 ml. So now what I've done is I reconstituted with 40 ml normal saline and to make up 50. So I've got 4 normal saline, yeah,
Yeah.
vital signs check on the patient, especially the patient's respiratory.
and I've got
to see if the patient is having
5 hours of
respiratory
morphine into 10 mg in 2 ml to make up a total of 50. So I'm just gonna pop.
Yeah, Asisa, please be my second RN so we can do the medication validation. So the medication is for
Just going to prime my line now. Okay, so I've primed my line now. I'm gonna do my third and final drug check. Okay, could you please be my... Okay. Now I'm just gonna write my additive level. So the patient's name is...
a bit about the medication.
Adib Miriam.
The medication is morphine sulfate, which is normally used to treat moderate to severe chronic pains in cases where
ID is 174963. Date of birth is 07 01 1969.
asthma and
Medication, that's morphine,
the dose is 0.5 mg to 1.5 mg
50 divided by 50 equals to 1 mg per ml. Normal saline is the dilutant,
respiratory depression
0.9%. Date is 23 05 17. Time 10:50. Prepared by Moses. Lovo. Okay, now I'll sign that for you. Okay, now I'm just gonna do my my drug checks.
Yeah.
All right, so I'm gonna do from my second drug check. All right, so we've got Miriam Adib. MRA number is 174963. Date of birth is 07/01/69 under Dr. Hunt. The doctor ordered morphine, which is 50 mg in 50 ml. He printed his name and signed it and dated it. He left his pager number there. So the number, the concentration is 1 mg in 1 ml. Number of syringes is 3. PCA dose is 1 mg. Lockout interval is 5. So now I've already run my medication. I've already reconstituted it. So I have got 40 ml of normal saline, which is 4, which is four vials of this, which is normal saline, expired date December 18, normal saline expired date December 18, normal saline expired date December 18. And I've got my morphine, which is 5 vials. I've got morphine sulfate, 10 mg in 2 ml, 10, 20, which makes 20, which makes 10 if I add the total of 5. So morphine 10 mg in 2 ml, expired date 1020, morphine sulfate 10 mg in 2 ml, expired date 1020, morphine sulfate 10 mg in 2 ml, expired date 1020, morphine sulfate 10 mg in 2 ml, expired date 1020.
Yep.
Can you please be my RN to do my third and final drug check?
Yep.
Okay. So I've already reconstituted into this, and I've already signed the additive level, so I'm just going to put it there. Okay, so I'll explain what I did. So I've got Miriam Adib is the name, and MRN number is 17496. Date of birth 07/01/1969, under Dr. Hunt. Yeah. And she has nail allergies. The doctor ordered morphine 50 mg, which is already reconstituted in 50 ml, which is already reconstituted into this.
Yep.
So I've got my normal saline, which is 4 vials of 10 ml each.
Yep.
Which is added into 10 mg of 2 ml of morphine, which is in 5 vials, which makes a total of 50 mg. A total of 50 mg in 50 ml.
Yeah.
So that's it. So my morphine is morphine sulfate 10 mg in 2 ml, expired date 1020. Morphine sulfate 10 mg in 2 ml, expired date 1020. Morphine sulfate 10 mg in 2 ml, expired date 1020. Morphine sulfate 10 mg in 2 ml, expired date 1020. Morphine sulfate 10 mg in 2 ml, expired date 1020. So the normal saline as well, which is sodium chloride, which is the same thing, 0.9%, expired date December 18, sodium chloride, expired date December 18, sodium chloride, expired date December 18, sodium chloride, expired date December 18.
Yeah.
So it makes a total of 50 mg when in 50 ml when it's reconstituted.
Yeah.
So I'm just going to do my PCA setting. Do you mind coming with me so that we can do that, please? Okay. Could you please hold this for me?
Yep.
Just gonna set up my PSA machine.
Okay.
The patient, yes, confirm. So we've got morphine. 50 mg in 50 ml, which is going to be delivered in 1 mg per ml.
Yeah.
So now the concentration is 1 mg per ml, which is that one there. The PCA dose, which is same thing, which is 1 mg. 1 mg. Lockout interval, which is this one. Lockout interval is 5 minutes. 5 minutes. We don't have the continuous loading. We don't have the loading. We have the hourly dose. Which is 12 according to this. So we need to alter that, modify. So okay, that one there. So that is 12. Okay, confirm. Okay, so confirm if all this is right. So that's PCA dose 1 mg.
Yeah.
Lockout interval. I'm just gonna say what we have, what has been signed by the doctor. Lockout interval, which is 5. Continuous, we don't have. 5 5 minutes.
Yeah.
Continuous we don't have, loading we don't have. We've got a maximum of 12 mg per hour, which is this one here.
Yeah.
Alright, so good. Yeah, then that's okay. So I'm just gonna go over it again. So it's morphine is the drug.
Yeah.
Then concentration is 1 mg. The number of syringes is 3. Lockout interval is 5 minutes. We don't have the continuous, and loading we don't have. And the maximum per hour is 12 mg, which is 12 mg.
Yeah.
Okay. So. Okay. So. Okay. Okay, Miriam, I'm back. I've already set up your PCA machine, but before we do that, do you mind telling me your name and date of birth, please?
Miriam Adib, 7th of the 1st, 1969.
Okay. Miriam Adib,
Yeah.
and MRA number, that's
So the patient name is
174
963.
963. Yeah.
Yeah.
Before I connect the PCA machine morphine for you, I need to find out, do you have any allergies?
No.
No, okay. All right, so the machine is all good to go, but before I do that, I just need to connect it. So just give me a minute, please.
Then each N2 has 2 nodes. I've got 1, 2, 3, 4, 5. And as you can see, it's all neutral within that price. And also I mixed the morphine with the 40 units of Malasol. I've got 10 and few, I've got 4 N2s over here, which is like 10 minutes. So 1, 2, 3, 4, 4. And all of them are within the next phase.
Just gonna clean here, Miriam. Just bear with me. Please. Okay, thank you.
Okay, we will start to use the non-touch technique just to prevent any contamination.
Okay, Miriam, I'm just gonna teach you how to use the PCA machine before I go. Okay. So Miriam, as you can see, when it's down green, it means it's not working. It's not administering any morphine into you. But okay, could you please press the button for me?
For the patient,
Okay. So that's going. So if it's like that, it's going. So if you hear the sound, it means it's going. But now, so it's all good. So the thing is, you only press it maybe when you're feeling any discomfort and you need to move, so that at least the pain is controlled by the morphine. But I'll be checking you in 15 minutes intervals. So if you have anything, here's the buzzer. Just call me, then I'll be back and to assist you with anything. And also, if you definitely any medication has any side effects, like you might feel nauseous, you might feel dizziness, or it might cause you to have constipation. But if you have anything that is of concern, just press the call button, then I'll be back. But apart from that, I'll be back in 15 minutes to check on it. Thank you. Could you please be my RN to do my documentation?
Yeah.
Is it? So we've already administered our muffin. So the date is 23 05 17. Time, it was 10:50. Okay, so I'm gonna initial here. If you can put your initials as well. Okay. If I had already taken my, when I talked to her, say that this is the time I would have taken my obs. So then if I had taken the obs, this is where I was gonna put all my observations.
Okay.
Okay. So I'm just gonna clean up my my trolley.